My second talk today was to do with the late effects of LCH, and there's been a lot of debate about whether they should be called late effects necessarily, because they're not all late. Some of them can happen very early on, and one of the other concepts is to call them permanent consequences, because once they happen, you're stuck with them. So that's the other term that's used. I'd like to make it quite clear that not all children who have LCH end up with long-term problems. In fact, the majority of them don't. Because I don't want you, at the end of my talk, to come away feeling this is awful. Because not everyone has the problems. But if you don't look for them, and if you don't think about it, you'll miss it. And what I don't want is a child who's got problems to just be labeled as, not being very bright or just walking funnily, without someone realizing that that is a consequence of LCH and not just the way he is. So if you took a hypothetical 100 children with LCH, and we're talking about multi-system and single system all lumped together, about 50 of them, usually the ones who have single system LCH, get better with nothing. And in fact, the less the doctor messes with them, the less problems they have. And practically all 50 should survive without a problem. With the other half, some of them, all of them with multi-system disease, and some with bad single-system disease with lots of bones involved or a lot of skin involvement, might need systemic therapy. We're talking about things by mouth or injection. There's still that small proportion that we can't help yet, and we're working on the salvage protocol for them. But of the rest who survive, about half have sequelae, and half have nothing, minimal or nothing. But for every organ that LCH affects, there is this long-term problem that can arise. So with the bone and the orbits, you can have defects of the bone, you can have asymmetry of the face, bulging of the eyes that's still left over. Deafness could be permanent. Tooth loss can be permanent. With skin scarring, with the brain, with the pituitary, once you have diabetes insipidus, growth hormone deficiency, or any of the other problems, that's for life. They don't go away. The liver, sclerosing cholangitis, that's scarring in the liver and can cause cirrhosis. I'm not talking about that today very much. And the one thing that's different about it is it can happen anytime. It can happen very early on. So you can have active LCH in the skin and what looks like scarring in the liver very early on, and can be quite severe, but it is rare. Lung scarring can be a problem, and one of the problems that we possibly cause is a second malignancy with some of the chemotherapy and the radiation that we used to use. We've changed the protocol, we don't use those drugs anymore, and hopefully that'll reduce the incidence of second cancers. Bone problems. If you have isolated bony involvement or bony involvement as part of multisystem LCH, if you really went out and looked for it, about 80% of them will have problems that you can find. Not all of them actually affect the child. The fact that you've got a depression in your skull really doesn't mean very much to a child. It's interesting. You can go around showing it off. Some of them tell people they've been shot in the head, and that's they had a bullet in the head. But apart from that, it's not going to cause a problem. But yes, it is a consequence, and it's a leftover. Bulging of the eye, especially if it's one-sided, just makes it much more obvious because it never completely heals. Asymmetric face, and I'll show you a picture in a minute. And I've got pictures of most of these. One of the problems is loss of spinal height, and as Sheila showed, once you have a flattened vertebra, that never really corrects itself. If it's one vertebra, it's okay. If you have 6 or 8 of them that all collapse, then that bit's never going to grow, and your spine's always going to be that little bit shorter than someone else's. But surprisingly, the limb defects are unusual. If you've got a hole in the leg, it doesn't seem to cause a long-term problem. Maybe we just don't look for them. But they don't end up with one leg shorter than the other, or a big chunk missing for a long time. Now, most people say, everyone's asymmetric, no one's exactly the same, 2 halves. This is one of my patients who, she had ear involvement here and eye involvement on this side when she was a baby. Grew up, she doesn't think her face was particularly different. Because I do long-term effects of LCH for a living, I can see the difference. And so we did this as a joke, really. We took a picture of her, and then the medical photographer split it down the middle and made mirror images of the 2 halves. That's the normal half, and that's the half that had LCH. And that half just never grew. And she didn't have radiation therapy, because one of the things that does cause a problem is radiotherapy to the face or the head. That bit of the bone just doesn't grow. This child didn't. She had very minimal treatment. She had hardly any chemotherapy, a bit of steroid, nothing very much. But there is a difference. And I mean, and in fact, one of her eyes is actually lower than the other eye, and you can see it here. This is rather a scary scan, because the reason it scares me is because this is 10 years after the end of treatment. So this child's got no LCH, hasn't had any for 10 years. He's still got holes that you can see on the skull. Does it matter to him? He doesn't think so. But as a doctor, it's a bit worrying, because you can actually see right through here, and you can see right through across. But he had very, very extensive skull disease. If you've got one little hole or 2 or 3 little holes, it's probably not a big deal. But if you have extensive skull disease, then if this picture was seen by a neurosurgeon, they'd probably say you've got to put a plate in there, because they can't bear to see holes like that. We just watch it. Tooth loss. If it's just a couple of teeth, then you manage all right with it. But if you have a whole lot missing, I mean, this boy has a whole chunk missing here and a whole lot missing here, and although it might not look very bad, it means that your jaws don't align. And it's not just that you can't chew on that side, but your jaw doesn't grow very well. The rest of the teeth have no support, so they start falling out. And this is probably not as bad as some of the others I've seen, where one half of the jaw's grown more, or the lower jaw moves out, and then you have to have reconstructive surgery. So one of our patients has had to have his jaws broken, drawn back, and wired into place. So it is a long-term problem, but if you don't do it, then they just can't eat things that they like for a long time. They can't speak very well, and it causes lots of little problems. And you've got to think about the impact it has. Ear involvement. So here, this is active LCH, which is eaten into the ear. If it just affects the soft bit, the middle ear, quite often it'll repair itself and it's okay. And that's just a lump of LCH there. Occasionally it can go further in and involve this bit. That's the inner ear. And that's where your hearing system and your balance system live. Once those bones are destroyed, that's permanent. Very rare, but what you can get is permanent deafness, both ears. If you have hearing loss in one ear, you compensate for it. If it's both your ears, it's a problem. And the sad thing in this child was that she was very young. She was about 2.5. Hadn't really started speaking, went completely deaf over a few weeks. We didn't realize it. Mum didn't realize it. She would just curl up in a corner and she would scream. And they just thought it was disease. We didn't know what it was. By the time we realized she was deaf, it was too late to do anything about it. She's now got bilateral hearing aids, but she uses Makaton. She uses sign language, because and her speech really hasn't developed at all. And that's the sad thing, because if they're little, you don't know that they can't hear. And you've got to think about it. Skin lesions, occasionally you can get fatty deposits in the skin or long-term scars. So this boy had lymph node involvement, and they used to always be manky and draining, and they've remained as permanent scars. And someday, when he finishes growing, he's going to think about whether he wants surgery to have the scars removed.